Breathing is something we take for granted until it becomes difficult. In those moments, oxygen becomes our top priority, and knowing how to deliver it safely can literally make the difference between stability and emergency. Welcome back to NurseMatePro, the space where we learn nursing in a clear, visual, and stress-free way. Today, we'll explore everything you need to know about oxygen therapy, from the different types of devices and flow rates to the most common mistakes to avoid. By the end of this video, you'll have a simple and logical map to face this topic with confidence and calm. Oxygen therapy is the controlled administration of oxygen to maintain adequate oxygen saturation levels in the blood, also known as SpO2. It's used when a patient cannot oxygenate effectively on their own, such as in cases of respiratory failure, COPD, asthma attacks, shock, or trauma. The goal is to prevent hypoxia, which means a lack of oxygen in the tissues. But be careful, too much oxygen can be just as dangerous. The golden rule is balance, not too little, not too much. To assess the effectiveness of oxygen therapy, we use the pulse oximeter, a simple but essential tool. Normal values range between 95% and 100%. Below 92%, the patient needs oxygen support. However, in patients with COPD, values between 88% and 92% may be acceptable because too much oxygen can suppress their natural drive to breathe. So before increasing the flow, observe the patient, not just the number on the screen. Now let's analyze the main oxygen delivery devices, from the simplest to the most advanced. 1. Nasal cannula. Flow, 2 to 6 liters per minute. FiO2, 24 to 44%. Ideal for stable patients or long-term therapy. Always check the skin behind the ears and keep the nasal mucosa hydrated. 2. Simple face mask. Flow, 5 to 10 liters per minute. FiO2, 40 to 60%. Used for moderate oxygen needs. Never use below 5 liters per minute to prevent CO2 rebreathing. 3. Non-Rebreather mask with reservoir bag. Flow, 10 to 15 liters per minute. FiO2, up to 90%. Perfect for emergencies and severe hypoxia. Make sure the reservoir bag stays inflated. 4. Venturi mask. Flow, 2 to 15 liters per minute. FiO2, 24 to 50%, very precise. Ideal for COPD patients since it controls oxygen concentration accurately. And 5. High-flow oxygen therapy, HFNC, CPAP, BIPAP. Flow, up to 60 liters per minute, FiO2 up to 100%. Used in critical or acute cases, always with prescription and continuous monitoring. Oxygen therapy is only effective if it's also safe and comfortable for the patient. Here are 5 essential rules. 1. Never use open flames or electrical devices near oxygen. 2. Keep the skin and mucous membranes hydrated. 3. Monitor saturation frequently, especially at the beginning of therapy. 4. Observe patient comfort. An uncomfortable device reduces cooperation. And 5. Always explain what you're doing. Communication is part of the care. The most frequent mistakes we see in clinical settings are starting therapy without a medical prescription, forgetting to adjust the flow rate, leaving the mask disconnected, failing to document the procedure, or worse, not observing the patient's response. A confident nurse doesn't rush. They double-check every time. Let's recap in a few seconds. Nasal cannula, 2 to 6 liters per minute. Simple mask, 5 to 10 liters per minute. Non-Rebreather, 10 to 15 liters per minute. Venturi mask, 2 to 15 liters per minute. High flow, up to 60 liters per minute. And always remember, monitor, document, and observe. I hope this lesson helped you understand oxygen therapy in a clear and complete way. Here on NurseMatePro, we learn to manage every procedure with competence, but also with calm. If you'd like more lessons like this, subscribe to the channel and tell us in the comments which topic you'd like to see next. Together, we make studying lighter and nursing safer. Remember, you make the difference.